80% as per Queen's analysis, 80% of the patient who will visit a dentist whenever they're already in pain. What is your thought about this, doctor? Yeah, you are right. Actually, we found out quite some of the patients were scared, they're worried, they even have phobia. Personally, to be honest, I'm not using floss regularly. Hi, apa khabar? Welcome to Queen Podcast. Let's talk. I'm your host today, Shirley, and it's our pleasure to have Dr. Amer from Queen's Medical Center, Al Diafa branch with us today. He has 8 years experience in dentistry and helped more than 2,000 of patients create a perfect smile. Welcome to the show, doctor.
Hi, Shirley. How are you? I'm so glad that I'm here in this Queen's podcast. I'll try also to clarify a lot of information for the patients.
As per Queen's analysis, 80% of the patient who will visit a dentist whenever they're already in pain. What is your thought about this, doctor?
Actually, it's very true, Shirley. If there is no pain, there will be no problem. That's why we try to explain exactly about every procedure and to symbolize every treatment. This scenario, of course, we will try to tell the patients to come as early as possible for regular checkup and to have a treatment. The early treatment, less painful and of course less costly. Sometimes, of course, we need to take on one side that the patient will be scared of visiting us. That's a problem.
When you mention about scare, doctor, yeah, you are right. Actually, we found out quite some of the patients, they're scared, they're worried, they even have phobia. The moment they step in dental clinic, they are start sweating. What is your perspective on this? What's triggered their fear?
Actually, absolutely. It's very true about it also. In my opinion, it could be two ways. Either they have a very bad experience since childhood, which we call it traumatic experience, like extraction their teeth in a very bad way, or the sound of the drill or something like this. Or the other way could be the sound or the medical term itself. Like sometimes when I refer patients to do implant or surgical extraction or whatever, they will just hear this term and they will be scared and they will be, oh, it looks painful. But here where it is our modern dentistry, it comes in, and because we have advanced instruments and technologies that can help and make the treatment easier for them. Here where it comes also that we tell the patient to have a regular checkup with us, so they will avoid this phobia or this feeling, or also they can ask more about treatments, so they know how it's simple, how it's it's easy, it doesn't look painful. Mm-hmm. So regular checkup is very important actually for this.
Mm-hmm. When you mention about regular checkup, what is the frequency that the patient need to come for a checkup, and what they will do, like kind of what treatment is recommended when it's checkup? Or
regular checkup depends on each situation, but normally, and I guess all dentists they can agree on this, is every 6 months. But some cases where we have to interact as soon as possible and as fast as possible in such very moderate to heavy cases of, let's say, multiple caries, gingivitis, periodontitis, a lot of things there, then we have to interact earlier as possible, because also they have a confusion between patients that they don't know how to take care of their oral health, which is a very big problem. By using, of course, flossing, brushing techniques is different. They are not using mouthwashes. This is a big problem, actually.
Yeah, when you mentioned about floss, doctor, personally, to be honest, I'm not using floss regularly. I'm just using it whenever the food stuck in between my teeth. So actually, I believe a lot of audience is same boat as me, with me. So what is your advice, doctor?
I agree on that. Actually, this is a big problem that we are facing, because a lot of patients, they are use the floss, or even they don't know how to use it, which is why we are here, is just to give this advice or give the good instructions to patients. I will give you just a hint how you can use more frequently the floss. Is try to start gradually. Let's say start every 2 days, 3 days. If you feel that you are not using it forever, then start just every 2-3 days use it. Then start every 1 day, then start every meal. It will help a lot. And surely, believe me, a lot of patients, they come, they feel there is no pain. I will just do a checkup, and there will be a lot of problems between their teeth because of not flossing. That's a very big problem.
Doc, actually we have some confusion about dental cleaning and whitening. So can you explain us what are the difference between dental cleaning and whitening?
Okay, actually, this is a big difference, but yes, it's also a very big confusion between patients and our audience. See, I will just give it to be more simple to our audience, is just to focus on cleaning is just a health part, while a whitening or another cosmetic treatment will be just for the appearance or for the cosmetic actually reason. So the cleaning will be just removing the plaque or the bacteria, or try to stop the bleeding, try to heal the pockets or such on. While the whitening, it could be just cosmetic treatment.
Then what about the whitening? Is it permanent?
The whitening, no. First of all, we have to explain in detail before each procedure, and we tell the patient that the whitening will not last forever. Whitening procedure is just a temporary solution to whiten your teeth while we apply such a whiten gel that we will put it on teeth that will stay at least 2 to 3 months. Of course, it depends on each patient how much they are taking care of their teeth. Like as much as they are avoiding the colorful food or drinks, then the maximum result that they can get. On the other hand, if they need something more permanent, we try to tell them, like some patient, they will ask me, Doc, I need to look on something more permanent solution where I also can change my shape of teeth, not only color. Here, I will give them another option, which is like veneers, ceramics, zirconia crowns, whatever, just to try to give them the maximum result they want if they are looking for cosmetic. Again, here it comes without good health underneath this beauty or appearance, we cannot reach the maximum result in cosmetic, of course, like whitening or even veneers.
Thank you so much, Dr. Amer, to sharing with us his knowledge, useful tips with us. Before we ending this, Doctor, I have some internal sources that actually you are a great dancer as well. Because we always see the side of your focus, and we are like very focused with the patient professional side. So would you like, if you don't mind, show us the other side of you?
Yes, of course. This is kind of another hobby that I have since long time ago. But this will not affect, of course, my professional treatments, procedures. But yes, that's true. Actually, I don't know from where you get this, but yeah, it's fine.
Can you show us some little bit the other side of you?
No, now I'm sitting, so I guess it's kind of hard, but...
Let's do it. Come on now, let's show us the other side of you.
I guess you're always telling me that, okay, try to remove your head like this or moving like this, something, okay.
Oh, wow.
But again, I'm here always to help, so don't worry, I'm there. I'm so glad again that I'm here in Quiz Podcast, and I'm so glad that I can help patients. Always, please try to visit us, Queen's Medical Center, and be safe, guys.
So that's our wrap up for this episode today. Don't forget to smile and take good care of your teeth. Bye.